Hello, my dear students. We are continuing to study medical radiology, and the topic of our lecture today will be nuclear medicine, diagnosis and therapy with so-called unsealed radioactive sources. First definition: what is nuclear medicine itself? It's a branch of medicine which deals with diagnosis and treatment of diseases with the help of unsealed radioactive sources. All substances which are used in nuclear medicine procedures are radiation-emitting substances. They produce different types of radiations. And for us, for our therapeutic or diagnostic goals, most important among these types of radiation are beta and gamma emitters. Usually beta emitters are used in therapeutic purposes and gamma emitters for diagnostic procedures. It depends on difference in penetration power of gamma and beta rays in human body. Usually, beta radiation can cover very short distance in the human body, about several millimeters, not more than 1 centimeter. And on the contrary, gamma rays can go through the whole human body. If we are interested in delivering of radiation to certain areas of our interest, for example, for tumor, we will of course choose beta emitters because they will be accepted by tumor sites and irradiate tumor on very short distance, only tumor, and in the same time surrounding normal tissues will be spared. But if we want to look the whole picture of distribution of radioactive tracers in human body, we will of course choose gamma emitters because they can cover very much larger distance and may be accepted by detectors. Nuclear medicine procedures are different from non-radioactive diagnostic chemicals. For example, iodinated contrast media used in barium studies from CT scan and MRI imaging. Because in such procedures as sonography, X-ray, plain X-ray, MRI or CT, sound waves, radiation, magnetic fields are outside of patient's body and in the source. On the contrary, in nuclear medicine procedures, these radioactive substances are introduced directly into patient body and are used out of protective shields. Branches of nuclear medicine: diagnostic and therapeutic. Diagnostic may be divided on scans, diagnostic scans, and radioimmunoassay. We will not observe radioimmunoassay analysis in this lecture because we do not have enough time for this. But scans and therapeutic procedures will be presented. Nuclear medicine is unique because it helps to view how human body is functioning. This type of imaging takes very small amounts of radioactive pharmaceuticals and follows their path and progress through human body. X-rays or CT scans can show how something in human body looks, anatomical structures. But nuclear medicine can show how these structures actually works. Nuclear medicine images produces look at the bodily function to help make proper diagnosis, and nuclear medicine therapy can actually be used to treat the body. If your patient is undergoing a therapy process, then larger amounts of radiation will be used to treat cancer or thyroid disease, for example. Basic principles of nuclear medicine. In the whole medical diagnosis, imaging of two kinds can be differentiated. On one side, there are anatomical imaging providing a very accurate visualization of the internal structures of the human body. And on the other side, there are functional images, which is aimed to quantify the physiological process taking place inside the human body without influencing them. The main principle of nuclear medicine diagnostic is non-invasive determination of physiological process, or in other words, sufficient or is a function of organ of area of our interest, function of it is sufficient or insufficient. In other words, nuclear medicine is a branch of medicine that involves the administration of radioactive substances in order to diagnose or to treat diseases. A radioisotope is introduced into the body usually by injection, but there are many other waves and we observe them later. The radiation it emits detected by a scanner and recorded reflects its distribution in different tissues and organs and can reveal the presence, size, and shape of abnormalities in various organs. Radioactive substances are also implanted to treat small, early-stage cancers. This yields a slow, continuous dose that limits damage to normal cells while destroying only tumor site. All nuclear medicine procedures are connected with radioactive decay. What is it? What means radioactive decay? It's impossible to know at what time a certain radioactive nucleus will decay. And it's, however, possible to determine the probability of decay in a certain time. In a sample of some amount of nucleus, the number of decays per unit time is as shown on the picture. And here arises a very important term in nuclear medicine diagnostic and treatment. I mean so-called half-time. It's time during which the amount of radioactive nucleus will decrease by half, not charge, not time, only amount of nucleus. Activity, the number of decaying nuclei per unit of time. But I don't think that it's time for us now to focus on this, on activity. It's much better to observe diagnostic and treatment possibilities of nuclear medicine procedures. Ionizing radiation used in nuclear medicine may be presented as charged and uncharged particles. Charged particles are alpha, beta, and protons, and uncharged are photons or gamma and X-rays and neutrons. But again and again, I think it's not so important now, because all these types of particles of radiation are ionizing. That's enough for us now for this lecture. How scan procedure is done in nuclear medicine? First, radiotracer is prepared and delivered into the patient. Then gamma rays, which are produced by radiotracers, are detected by a gamma camera. Then next step is processing and reporting of the whole procedure. Radioactive tracers may be alone or radioactive moiety combined with organ or system specific pharmaceuticals. Examples of alone radioactive tracers are technetium and iodine, for example, and if we need to combine radioactive tracers with so-called pharmaceuticals, we can choose from very from amount of chemical substances. Then, next step, delivery of radioactive tracer. The main way is intravenous injection, is most common way. But radioactive traces may be delivered in many other ways. For example, orally, maybe inhaled, maybe introduced into cavities or into shunts. It depends on your diagnostic purposes. Then the next step is gamma camera image acquisition. After injection or inhaling of radioactive tracer, we need some time interval post delivery in order to give radioactive tracer to distribute through the whole body and to be accepted by our areas of interests. Then patient is asked to lie in certain position. After proper positioning, we will have opportunity to make scans. Next step is reconstruction and processing of obtained data on special software. The final step is imaging images reproducing on page, film or disc, CD or DVD. Sorry. Sorry. And final point is reporting. Just review of all available clinical data and images, and then radiologists make report, generate report. Now, again and again, maybe you didn't understand what is idea of combination of radionuclide substances, radioactive substances, and pharmaceutical. The idea is very simple. Radionuclide is only tracer, and pharmaceutical is some special molecules which have affinity to different tissues and organs for different zones of our interest. So pharmaceuticals will deliver radionuclide isotope to that zones what you need, and will remain them in these specific areas. After that, radionuclide will continue to irradiate gamma rays, for example, and these gamma rays may be detected by scanner. Maybe in other words, what is radiopharmaceuticals? Radioactive materials administered to patient are known as radiopharmaceuticals. These consist of chemical molecule which determines the behavior of radiopharmaceuticals in the body, and the radiation emitted by radionuclide or isotope may be detected from outside of the body by imaging device, for example, gamma camera, or may be detected in the sample of the body fluid, for example, plasma, urine, blood, if we are talking about radioimmune analysis. You see that there are very many pharmaceuticals which have affinity to certain organ, and they may be combined with specific radionuclides, radioactive isotopes, and deliver them to liver, lung, kidneys, thyroid tissue, to the whole body. What do you need? Again, sorry. Productions of radionuclides. It's great industry indeed. Usually radionuclides are produced in devices which are called medical cyclotrons or industrial cyclotrons. Of course, it's not a very easy procedure, and not every radiological department may allow to maintain such high technologies. But if this radiological department can allow, then we are going to the next steps of nuclear medicine procedure. It's preparation and dispensation of radiopharmaceuticals. Usually it's done just before administration of radiopharmaceutical due to very short half-time life of all radionuclides that are used in nuclear medicine diagnostic, and in order you should have time to be in time while isotopes will not decay at all. Unsealed or open sources in nuclear medicine, it's very huge amount of them, and I don't insist that you should remember every of them. It's no need. Our critical points are half-life and type of decay. Because half-life give us a limit of time to operate with radionuclides, and type of decays give us opportunity to choose for what are we administrating these radionuclides, for diagnostic or for treatment purposes. But among this huge amount of different radionuclides, unique and universal radionuclide for nuclear medicine diagnostic is isotope of technetium. It has a very short half-life time, and after administration it will decay completely after very short period of time. Usually we say that 10 times of half-lives is enough for radioisotope to decay completely. So if we administrate technetium after 60 hours, not more than after 3 days, it will be removed from a human body. For imaging, technetium is used extensively as it has following properties. First of all, technetium is a gamma emitter. This is very important as the rays need to penetrate through the whole body, so the gamma camera, the detector, can detect them. It has a short half-life, about 6 or 6.5 hours. Thus, the amount of radioactive exposure is limited, as for patient, as for medical staff of radiological department. It's readily attached to a variety of different substances that are concentrated in various organs. For example, depend on pharmaceuticals. It may be accumulated in bones, in liver, in spleen, in lungs, and in other organs. Only choose special molecular which have affinity to tissue of our interest, and combine this molecular with radioisotope of technetium. It's easily produced just on site, just before administration. What are advantages of nuclear medicine over conventional radiography? First of all, its possibility to study target tissue functions. Next, all similar target tissues can be examined during one investigation. For example, the whole skeleton can be imaged during one bone scan, and you don't have need to administrate, for example, CT scan of first skull, then chest, then abdomen, and so on. And computer analysis and enhancement of results are available. This opportunity exists also in CT and MRI, and even in ultrasound images, but let's don't forget about this. Maybe I'll repeat something, but repetition is always useful. First step is producing of generation of radiopharmaceuticals and radioisotopes, and then administration. Usually, let's repeat again, usually by intravenous injection. There are three main types of nuclear medicine techniques: gamma camera, single photon emission computed tomography, and positron emission tomography. All they are based on the registration of radiation from radioactive label or tracer introduced into human body, but some differences exist. Sorry, I should explain you on this slide. Gamma camera or scintigraphy usually uses detectors which are placed in anterior or posterior position to the human body. If we use gamma camera, we place detectors in anterior, posterior, or posterior and anterior projections and receive scans of the whole body. It's very nice technique, but limitations. The fact is that radiation spreads in all directions, and some part of radioactive beams may avoid detector if it is placed only in anterior-posterior projections. And of course, it will influence on the quality of imaging. The way out was found when rotation and three-dimensional reconstruction was proposed to next step of nuclear medicine techniques, particularly for single photon emission computed tomography. If detectors are circling around the patients, every beam will be catched, and images from all these beams will be present on the final films. Positron emission tomography. We use some different techniques. I mean that in positron emission tomography, I used positron-emitted radionuclides. Positrons are particles with positive charge and mass equal to electron. When these emitted positron meet electron, the result of their collision is an annihilation of both positron and electron. And the final product are two gamma rays which spread in different directions at the angle of 180 degrees. Both of these gamma rays are catched by gamma camera detectors, and of course it essentially increase sensitivity and diagnostic possibility of imaging. A variety of radioisotopes which can now be used clinically in positron emission tomography include the following, but universal is molecule of fluoxyuridine glucose combined with isotope of Tor-18. Why we choose, and most of diagnostic centers choose this combination of radioactive tracer and radiopharmaceutical. Glucose, molecule of glucose is uptaken predominantly in tissues with very high metabolism. First of all, it's malignant tissues, brain, and myocardium. From this fact arise indication for use of fluoxyuridine glucose in nuclear medicine diagnostic. Most of cases are cases of oncology of different sites, and also may be useful in neurology and cardiology. Nuclear medicine imaging detects functional, not anatomical, but predominantly functional properties of human tissues. The imaging is done by tracing the distribution of radiopharmaceutical within the body with a gamma camera or SPECT apparatus or PET apparatus. Now let's observe some examples of nuclear medicine diagnostic. Bone scan. Bone uptake of technetium reflects bone metabolism and blood flow and allows to provide functional analysis of bone turnover. The ability to image bone metabolism alteration enables detection of lesions such as, first of all, very important, bone metastasis, to provide differential diagnostic of benign or malignant bone tumors, or also to search for sites of bone trauma. acute or in past. Three-phase acquisition procedure is required in order to detect osteomyelitis. Usually, bone scans is taken after injection of some amount of technetium and imaging after 3 hours after injection. This waiting time is necessary for distribution of radioisotopes through the whole body, through the whole bone system. Examples of bone scans with radioactive technetium. You see the normal bone scans where uptake of radioisotope is equal in all parts of skeleton, and on the contrary, scans with multiply hot spots, which shows us sites of bone metastasis from some primary tumor. Doesn't matter from which, from cervical cancer, from lung cancer, and so on, but just it helps us to reveal the pathology in the whole bone system. Also, nuclear medicine diagnostic may be very useful in searching of lung pathology, especially in pulmonary embolism. It's the most quick and the most cheap and the most reliable way of diagnostic of pulmonary embolism. It's very important in urgent practice. After intravenous injection of technetium as radioactive tracer combined with specific molecular which have affinity to lung tissue, and after immediate scanning we may obtain very clear pictures where blood flow in lung tissue is insufficient. Also, the same techniques may be used in ventilation studies, not in study of blood supply of lungs, but in study of ventilation. Ventilation studies with technetium aerosols reflect the regional and segmental ventilation. Study interpretation is performed in conjunction with perfusion findings, supporting the differential diagnosis of pulmonary embolism. Usually, some amount of inhalation of technetium combined with aerosols is needed, and then immediate scanning is performed. Thyroid gland. Thyroid scintigraphy with different isotopes of iodine or technetium pertechnetate offers structural and functional information by displaying the thyroid image and calculating uptake, organ volume, and many different parameters. Usually it's done by intravenous injection of technetium pertechnetate or different isotopes of iodine which has affinity to especially to thyroid tissues. Here is example. It's very old photo technique of registration of steroid uptake of radioisotopes is known for many decades. And for example, we can see on this slide arrowed by a red arrow presence of hot node, so-called hot node in thyroid gland. It's area of increased uptake of radioactive trace. Usually it shows us a site of malignancy of in thyroid gland. Kidneys, determinations of kidneys clearance with the same isotope technetium combined with another radiopharmaceuticals allows us to registrate in reliable and very easy way the function insufficiency to detect insufficiency of renal function. Let's look at the next slide. Here we see that curve which reflect function of right kidney in green color is quite normal, but left kidney this curve is much lower. It means that there are lack of normal renal parenchyma in left kidney, and of course this leads to lack of left kidney function. In cardiology, myocardial perfusion is a very important thing, and nuclear medicine techniques allows to estimate level of myocardial circulation. The best isotope is thallium. Its accumulation in myocard depends on blood flow and cellular metabolism, hence reflects regional perfusion and viability of cardiac muscle. The evaluation of a patient suspected or known for coronary artery disease is based on image interpretation and analysis from reconstructed tomographic slices, which also yields regional perfusion information. This examination with the isotope of thallium is performed under first maximum stress condition and after rest to check difference. Stress means intensive physical exercises. Injected activity of thallium is shown, and immediate tomographic study, especially after stress, after intensive physical exercises, is performed. Here is example of myocardial perfusion after stress and in rest. You see that there are no difference between blood supply in stress conditions and in rest, so it's normal nuclear medicine investigation of myocardial perfusion. Cerebral blood flow, or with the same technetium combined with special molecular, another special molecular, or similar compound retained in the brain in proportion to regional cerebral blood flow. It allows to detect pathologies predominantly in gray matter and doesn't show redistribution. Very useful in detection of brain dementia such as Alzheimer's disease, different forms of pathological blood flow in brain, cerebral vascular problems such as ischemia, trauma, or brain death. Again, intravenous injection of some amount of technetium and detection after 30-40 minutes after administration of radioactive trace. But it's all very nice. But very essential problems still exist because nuclear medicine studies show, as we have discussed previously, show function, show distribution of radioactive tracer in the whole body or in special tissues, in tissues of our interest, but they didn't show anatomy. So when you look at the nuclear medicine picture, you can't say exactly where is pathology, location of pathology. In order to avoid these limitations, hybrid imaging were proposed. Combination of single photon emission computed tomography with CT or positron emission tomography with CT, or both these methods in combination with magnetoresonance imaging. What it means in practice. If you look at positron emission tomography picture, you can conclude that something is wrong. This black area is abnormal, of course, but you can't say where is it. You can't establish location of this pathology. But when you combine, when you overlap positron emission tomography imaging with usual CT, everything becomes more clear. And after this overlapping, we may say that pathology in one of main bronchus, in this picture, in left main bronchus. And this is a real, very reliable step for radiotherapy planning, because after downloading of both positron emission tomography scans and CT scans into radiotherapy planning system, we can choose fields for irradiation. Now, I think it's last slide. Yes. Thank you for your attention. Don't forget to find additional addition for this lecture. It's short films in which we will find general information about all nuclear medicine techniques. Thank you for your attention.